Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, Essential Reads: Prenatal Exposure to Valproate and Risk of Neurodevelopmental Disorders in Offspring. Break. While it is widely recognized that valproate is a teratogen, its impact on fetal neurodevelopment and the subsequent risk of neurobehavioral disorders is less widely discussed. Multiple studies have shown that exposure to valproic acid during pregnancy is associated with an increased risk of autism spectrum disorder. In addition, gestational exposure has been linked to lower IQ and a higher likelihood of learning disabilities, particularly an increased risk of intellectual disability. An excellent systematic review and meta-analysis was recently published by Chittaranjan Andrade and colleagues and provides further compelling evidence against the use of valproic acid in women of childbearing age. Systematic review and meta-analysis. Greater than a total of 8 cohort studies, including over 6 million pregnancies. Met the inclusion criteria. 6 studies were retrospective and 2 were prospective. The countries represented included the United States, N equals 3, Denmark, N equals 2, United Kingdom, N equals 1, France, N equals 1, and Pakistan, N equals 1. Risk of autism spectrum disorder. Exposure to valproate. At any point. In pregnancy was strongly associated with increased risk of ASD in offspring. Any exposure during pregnancy. Adjusted hazards ratio, R, 3.10, 95% C, 2.24 and number 147 4.28, N equals 1,841,198. High dose valproate, 1000 mg/day. R 6.32, 95% C, 3.12 and number 147 12.80. Valproate monotherapy. R 4.21, 95% C, 2.97 and number 147 5.95, N equals 1,745,253. Third trimester exposure. R 3.04, 95% C, 1.98 and number 147 4.66, 2 studies. Importantly, in discordant sibling analyses, a design that minimizes genetic and environmental confounding by comparing risk in exposed versus unexposed siblings, the risk of ASD remained strikingly high. Discordant sibling exposure. R 6.42, 95% C, 2.02 and number 147 20.42, N equals 1133. Risk of attention deficit/hyperactivity disorder. Findings for prenatal exposure to valproic acid and risk for ADHD were more modest. Be less than /speak. Any exposure during pregnancy. R 1.62, 95% C, 1.30 and number 147 2.01, N equals 24,295. High dose valproate. Non-significant increase, unadjusted RR, 7.69, 95% C, 0.17 and number 147 358.36, 1 study, N equals 241. Clinical implications. This is the first meta-analysis examining neurodevelopmental outcomes following in utero exposure to valproate. While the results are not surprising and have been noted in previous studies, the magnitude of the risks associated with valproate exposure is striking and highlights the need for vigilance surrounding the use of valproate. In addition, it must be emphasized that the risks associated with valproate are not limited to the first trimester. Although exposure to valproate later in pregnancy may not be associated with teratogenic risk, there continues to be a significant risk of adverse neurodevelopmental outcomes. The findings indicate that prenatal exposure to valproate is associated with a Break substantial. Break elevation in ASD risk, R, 3.10. Break there is a. Break modest. Break increase in ADHD risk, R, 1.62. Break high dose valproate exposure further magnifies ASD risk, R, 6.32. Break risk for ASD is the highest with third trimester exposure to valproate, R 3.04. Break dose dependency and sibling analysis results support a causal role for valproate in these outcomes. Break although the use of valproate in pregnancy has declined in several countries over the past decade, prescribing patterns remain inconsistent worldwide. Valproate is still commonly prescribed to women of childbearing age and number 148, even during pregnancy and number 147, in certain regions. Break given the accumulating evidence of adverse neurodevelopmental outcomes, valproate should be avoided in this population whenever clinically feasible. Rutan X, MD PhD. Break reference. Break Andrade C., Varadara John N., Bhaskaran S., Kale, Nanadas J., Menon V. Break gestational exposure to valproate and autism spectrum disorder or attention deficit/hyperactivity disorder in Offspring, systematic review and meta-analysis. Break Actor Psychiatrist and 2025 June, 151 668-679, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.